Idaho in crisis. North Idaho hospitals have run out of space and staff. Doctors in North Idaho have been warning about this for months, and they say cases are only going to get worse.
For the first time since the pandemic started, the Department of Defense has sent medical help to the Panhandle. Rania Kaur spoke to doctors on the ground about the help they're going to be giving.
Nia, 120 extra staff members are certainly going to help the situation here in Idaho, but that won't solve the issue. Right now, Chief of Staff Dr. Robert Scoggins today frustrated for nurses, physicians, and staff.
Just that, emotional trauma that the nurses see day after day it wears on you over time. And really, we've been doing this for, like I said, a year and a half, and our unit's been open for over a year, and that hasn't changed.
Kootenai Health is over their capacity for COVID patients. While they've expanded their emergency room and even converted conference rooms, they're still in crisis because of a lack of staffing.
Our biggest limitation at Kootenai Health has been the number of staff we have to cover the additional surge in COVID patients and maintain urgent and emergent services for our entire community.
20 members of the Department of Defense are now in the hospital. This video was given to us by the Department of Defense. Major Ian McInnes is one of the 4 doctors deployed here.
We're also incredibly fortunate to be able to be here and provide some much needed offloading of that stress on this local system, hoping to be able to provide a little bit of room to breathe.
Kootenai Health right now has 550 positions open. About half are for clinical staff. So even with those added resources, it's still not enough.
We're at risk of getting more patients, and I think that's our concern as our schools open. There's no mitigation in place in our school systems at this point, and I'm concerned about what's going to happen over the next few weeks.
But right now, Catherine Hoyer, spokesman for the Panhandle Health District, says any help is better than none.
Any moving of the needle to help Kootenai Health right now is really what we want to help with, what the state wants to help with. Absolutely appreciative of the 20 that they've been able to accommodate, but Kootenai Health has requested hundreds.
To put it into perspective, Kootenai Health is usually staffed for about 26 ICU beds. Right now, they have around 40 patients in their ICU, and they anticipate to get worse. Unless the patients flatten, Kootenai Health will not be reverting their crisis standards of care anytime soon. Live in Coeur d'Alene tonight, I'm Rania Kaur, 4 News Now.